Feel free to say hello to each other, where you're from, in the chat if you'd like to. I got someone else to let in. You don't hear it on your side, but I get a little chime in my headset every time someone wants to come in, and a little ding dong. So hello and welcome to the latest installment of the American Journal of Sexuality Education lecture series. My name is Bill Taverner and I'm the chief editor of the journal, and thank you for joining us this evening. I'm very pleased to introduce our guest speakers this evening, Kaylee Richmond and Zoe D. Peterson. Kaylee is a graduate student at the University of Missouri, St. Louis. Broadly, her research interests include sexuality education and sexual consent. Dr. Peterson is Associate Professor of Counseling and Educational Psychology and Director of the Kinsey Institute Sexual Assault Research Initiative at Indiana University. Together, they are the authors of Perceived Sex Education and its association with consent attitudes, intentions, and communication, which was published in volume 15 of the American Journal of Sexuality Education. Our speakers are going to speak for about 15 to 20 minutes, and then we'll turn it over to Q&A. Before I turn it over to our speakers, if you give me just one moment, I'll let a bunch of people in. And so welcome to our speakers, and we look forward to learning from you this evening.
Thanks, Bill. Thanks for having us.
Thank you. All right, so we have a presentation, so I'm going to attempt to share my screen now. Let's see. And then give me a thumbs up or some kind of vocal thing that we all see the screen. Okay, so again, my name is Kaylee Richmond, and I'm a graduate student in the clinical psychology program at the University of Missouri, St. Louis. As Bill said, my research is in promoting healthy and pleasurable sexuality, and that's through sexual consent research as well as sexuality education. Zoe, you want to introduce yourself?
Yeah, so so Bill gave me a pretty good introduction. Most of my research is in sexual assault, sexual consent, unwanted sex, those types of areas. And I was at the University of Missouri, St. Louis, and was Kaylee's mentor, but I have recently moved to Indiana to the Kinsey Institute.
All right, so before we begin, just want to thank Bill again for inviting us to present in this lecture series. We really hope you enjoy this presentation, and we will be taking questions at the end. All right. So today's agenda, I'm going to be presenting on the background, present study, hypotheses, results, and exploratory analyses. Then I'm going to hand it off to Zoe, and she's going to present on conclusions, limitations, and future directions. All right, so why is it important to examine sexual consent? As you all likely know, rates of sexual assault are outrageously high. 20% of women experience sexual assault just during college. Other studies have even higher numbers, with like 36% of women and even 17% of men experiencing sexual assault. And experiencing sexual assault can have long-lasting physical, psychological consequences such as PTSD, suicidality, anxiety, depression, chronic pelvic pain, academic performance outcomes. And as we know, sexual consent is often considered a defining characteristic of sexual violence. Thus, examining sexual consent may be a potential avenue to aid in the reduction of sexual assault. All right, so just so we're all on the same page, we define sexual consent as freely given willingness to engage in sexual activity among all partners involved, and this can be communicated verbally, non-verbally, with the clearest form typically being verbal consent. All right, so we specifically chose to examine attitudes, intentions, and behaviors of sexual consent, as attitudes and intentions have been associated with predicting behavior, i.e. behavior to communicate consent, and the ability to communicate with one's partners regarding sexual consent may promote enjoyable and healthy sex, which is a good thing. Due to sexual consent's significance, we were really interested in how it is learned and how it develops. And so we chose to explore how sex education may relate to consent attitudes, intentions, and behaviors, because sex education has been found to be related to all of those three things regarding other sexual outcomes such as contraceptive use. And also just practically, one would think we may learn about consent through sex education. As we know, sex ed does not come from one source, so we also wanted to make sure to examine it from multiple sources such as school, parents, peers, and media. And surprisingly or unsurprisingly, this relationship has not been examined within the literature. All right, so we, as you know, theory is very, very important in research and just in general. We chose the sexual health model by Robinson and colleagues, 2002, as a guiding framework because it posits that sexually healthy people will make sexually healthy decisions, and it provides 10 core domains of sexual health that they believe are important in promoting sexual health. As such, this model has the potential for explaining how high-quality comprehensive sex ed might promote adaptive consent attitudes, intentions, and behaviors. No research has been specifically looked at with sexual consent, but it has been applied to other sexual health outcomes such as sexual offender treatment and sexual dysfunction. And here are the 10 themes. I won't read them, but you all can read them. All right, so current study. So having a better understanding of the relationship between sex education and consent may help to inform interventions aimed at reducing sexual assault. So the purpose of our study was to explore how perceived amount, perceived quality, and source of sex education about those 10 sexual health model themes related to individuals' attitudes towards consent, intentions to seek consent, and verbal communication of consent. Hypotheses. So we hypothesize that greater perceived amount and higher perceived quality education about those 10 themes would be associated with more positive attitudes about sexual consent, greater intentions to seek consent, and more direct communication of consent. So a little bit on methodology. The study was online, Qualtrics. We had an MTurk sample as well as a university subject pool, and criteria was being over 18 and growing up in the United States. Our final sample included 315 individuals, average age about 28, mostly female, mostly heterosexual, and highly educated. And I'm gonna go briefly over the measures utilized in this study. So this was a self-designed instrument, and it asked questions about where individuals learned about sex information related to all 10 of those themes. And it asked about how much, as well as how valuable this information was from each source. So the school, parents, peers, and media. We originally expected a quality as well as a quantity score, but the items were really highly intercorrelated at like 0.95, I think. And so this measure ended up being one total perceived sex education score. And higher scores indicated higher perceived sex education. And then positive attitudes towards consent came from the subscale within the sexual consent scale revised. Higher scores indicated more positive attitudes. Intention to seek consent came from Hust et al. 2014-2015, and higher scores indicated greater intentions to obtain consent. And then the verbal consent communication came from a subscale within the consent to sex scale. Higher scores indicated use of more verbal cues to communicate sexual consent. And although consent can be nonverbal, we predicted verbal cues subscale because the items on that subscale reflect the most direct and unambiguous communication of consent. And then we also measured sexual knowledge, and this was used to evaluate accuracy of perceived sex education. It was also self-designed as we were unable to find a measure that captured just sexual knowledge and what we were trying to measure. It was 20 items in total, mostly multiple choice, a couple true false. This is an example item. And the answer is vagina, by the way. And all questions were related to STIs, birth control, and anatomy. No questions were related to consent or communication. All right, so we'll go over a little bit of like preliminary analyses, jump into the results, and then I'll talk about exploratory analyses. So this is the bivariate correlation table of all our variables of interest, and just of note are the blue rectangle thing I got going on as well as the green one. And as you can see, perceived sex education was positively correlated with the attitudes, intentions, and communication. And then in the green box, it's perceived sex education had a near zero correlation with sexual knowledge, which is not what we were expecting. And we'll talk about that more later. All right, so we examined differences between the dependent variables as a function of demographics. And as you can see here, we chose to use assigned sex rather than gender because virtually all our participants identified as cisgender men and women, as well as we theorized that gender role socialization, which typically determined by sex at birth, would be more important than gender identity in predicting our outcome variables. And as you can see, females had significantly more positive attitudes as well as more verbal communication than males. And then in relation to age, higher age was associated with both lower positive consent attitudes and lower intentions to seek consent. And then higher education was associated with lower intentions to seek consent. All right, so main analyses, and again, significant demographic variables were controlled for in the following analyses. We also wanted to examine whether these demographic variables moderated the hypothesized relationship between perceived sex ed and consent-related outcomes, and we'll talk about that some too. So hypothesis 1 was supported. So perceived sex education was positively associated with positive attitudes towards obtaining consent. And here is a fancy table. I'm going to breeze through these tables for sake of time, but we'll be sharing this PowerPoint with you all at the end. And for hypothesis 2, perceived sex education was positively associated with intentions to obtain consent, but only for those with relatively fewer years of general education. Another table. All right, so here's the interaction. As you can see, participants with fewer years of education had significant positive relationship between perceived sex ed and consent intentions, and that was not found for those with higher levels of general education. In addition, participants with lower levels of education scored significantly higher than those with higher levels of education on intentions to seek consent when perceived sex education was high, and this was not the case at low levels of perceived sex education. And then hypothesis 3 was not supported. And another table. All right, so exploratory analyses. So as I mentioned earlier, in the bivariate correlations, there was a near zero correlation between perceived sex ed and the objective sexual knowledge. And so that was interesting. And so we decided to rerun all of the results with sexual knowledge as the predictor, again, controlling for any significant demographics. All right. All right, so what do you think people did on average with this questionnaire? And I can't see people's chat, so either someone tell me what it says or someone speak. Oh, can't hear Bill.
Oh, sorry about that. Someone is suggesting poorly. Someone is suggesting
yeah.
60% correct, 40% correct is another guess.
All right, that was pretty close. The first one, 62%, which actually is better than I thought, but it's still not really great. All right, so here is our table. What's more interesting though is the interaction. So as you can see, objective sexual knowledge was positively related to positive attitudes towards establishing consent for men. Also, at low levels of knowledge, female participants had more positive consent attitudes than men, but the sex difference disappeared at high levels of sexual knowledge. Another table. So objective sexual knowledge was not found to be related to intentions to seek consent. And then for our last one with verbal consent communication, objective sexual knowledge was positively related to verbal consent communication. So now I'm going to hand it off to Zoe, and you just let me know when you want to change slides.
Okay, sounds good. Okay, so I'm going to just sort of summarize and talk a little bit about implications and limitations of this. So as Kaylee said, our hypothesis that greater quality and quantity of sex education would be associated with positive attitudes was supported. So people who felt like they had better quality sex education across those broad topics did report more positive attitudes toward establishing consent. So sort of speaks to the importance of good sex education, that it makes people more open to and feel better about consent, which is of course important. Okay, you can go ahead. I keep forgetting I don't have control over this. So we found partial support for our hypothesis that quality and quantity of perceived sex education would be associated with intentions to seek consent. So this relationship only held true for those with lower general education, which was a bit surprising. And perhaps even more surprising is there was a substantial and significant difference among those that perceived they had good sex education. Those with less general education had more intentions to seek consent than those with more general education. In general, a lot of the research suggests that education, greater education, is associated with better sexual health outcomes. So people with more education tend to be more likely to use contraception, for example. However, there are some studies, especially around parents' attitudes, that suggest that parents who have less education actually have more progressive attitudes about sex in relation to their children. So for example, they're more open to their children having ready access to condoms, for example. So this relationship between sexual attitudes and education actually in the literature in general is a little complicated. And if we think about this specifically in relation to the concept of consent, one thing that Kaylee and I have speculated is that greater education, especially college level education, where there's a lot of attention on sexual assault and sexual consent, especially when that's then combined with greater sex education, actually may in some ways make people a little bit skeptical of their ability to manage consent negotiations. So I think in reality, talking about consent is actually pretty complicated. It's not just, do you want to have sex? It's talking about different types of sexual acts, what you're comfortable with. It's communicating in ways that's clear to your partner. So there may actually be some sort of effect of greater education makes people perhaps more realistic about their intentions to seek consent, and they realize it's perhaps a little bit more complicated than those that maybe have less education. So perceived sex education was not associated with actual verbal communication of consent. And so this is in some ways perhaps the most important variable. It measures actual behavior. And this is a little bit surprising given that positive attitudes were associated with perceived sex education and intentions were, at least for some participants. But I think there's a couple of ways to make sense of this. One is that we really focused on direct verbal communication of consent in our study. And we know from lots of research that consent is often communicated non-verbally. And so it may be that a lot of people, are communicating and perhaps even communicating quite clearly about consent, but they're doing so in nonverbal ways. And we didn't really tap that in this study. So it would be interesting to look at consent as it's kind of more broadly defined and how that's related to sex education going forward. I also want to mention that, in general, there was very little variability in our ratings of perceived quality and quantity. So we really did have a floor effect. Most people were saying I had very poor, very little sex education across sources. And so this kind of limited our ability to explain much of the variance in these variables. So someone actually I noted had mentioned in chat, are these findings clinically significant given that the effect sizes are quite small? And I think that's a really important point, that, there was some significant results, but generally the effect sizes were small. Which I think speaks one, to the fact that we had this kind of restricted range, but I think also to the fact that probably the factors that play into consent attitudes and behaviors are so complicated. There's probably a bajillion factors that influence that. And so, so it's probably not surprising that we weren't able to explain a lot of that variance. Okay, so I think one of the more interesting aspects of our study is that people's perceptions of the quality and quantity of their sex education was utterly and completely unrelated to their actual sexual knowledge on a knowledge test. And as far as we can find, there don't seem to be other studies that have really looked at this, at how people feel about the quality and quantity of their sex education and how that relates to their sexual knowledge. But there is a little bit of research that's looked at what people think their knowledge level is and how that corresponds to their actual knowledge. So for example, the study we cite here asked people, you know, how good do you think your knowledge about sexually transmitted infections are? And on average, people thought that their knowledge was above average, which automatically suggests that perhaps they're a bit overconfident, because on average, their knowledge should be average. But they rated their knowledge as above average when their actual knowledge was poor. So on that measure, they got about 43% correct. And so it's possible that the same thing is happening with perceived sex education, that people are feeling like their sex education is good when perhaps it's not. We also think that, especially with sex education, people who have really good sexual knowledge may actually be more critical of their sex education looking back. So if they've developed good knowledge somehow, they may look back and think, look at all the things my parents or my school didn't teach me about sex. Whereas those with lower sexual knowledge may overestimate the value and the quality of their sex education because they're not aware of those gaps in their own knowledge. So importantly, when we've used knowledge as the predictor, we found that knowledge was predictive of attitudes, much like perceived sex education was, but also of actual behaviors. So greater knowledge was associated with using more direct verbal communication, which I think is encouraging and supports the idea that if people have good education that gives them good knowledge, that this could then improve consent behaviors. So some limitations, and I've already kind of discussed some of these. These were retrospective self-reports, so some people were trying to remember sex education quite a ways in the past, which is obviously a limitation. And also social desirability and recall biases are sort of always a limitation of self-report data. I already mentioned that our perceived sex education scores tended to be very low, so we had sort of a floor effect. We also had sort of a ceiling effect in terms of our consent outcome measures, so our consent attitudes and intentions and behaviors. Generally, people had positive attitudes about consent, thought they would get consent, and thought they did verbally communicate about consent. Which is good, but also then I think limited our ability to kind of detect differences. These are cross-sectional data, so we can't speak to the ordering effect of any of these variables. We theorized that, you know, better sex education would lead to better consent attitudes, but we can't determine that, obviously. We self-created these measures of perceived sex education and sexual knowledge. We couldn't really find anything that tapped these in the way we wanted to. So these were new measures, although we did find some decent internal consistency, and they were related to at least some of the variables we expected them to be related to. And then our sample was fairly homogeneous, so mostly white, mostly heterosexual, and predominantly female. So I think it would be really interesting to look at this in a larger, more diverse sample so that we could look at sort of potentially more of those moderating variables, which we may not have been able to detect here. So implications. I think one of the implications is that we think there's a need for high quality sex education. In general, participants said they got very little sex education across all sources, but in particular, actually, they said they got very little education from parents and from schools. So those were the lowest rated, both in terms of quantity and quality. So thinking about parent interventions, training for parents to help them better educate students. I think probably most of us on this call can agree we need better comprehensive sex education in schools. But interestingly, participants did say that they got slightly more and slightly better, still not good or much, but from their peers in this study. Now, we also know that their assessments may not be accurate because it didn't correspond with their actual knowledge, but at least they felt like that was a good source of information, even if it wasn't in reality. And so thinking about, well-designed programs that could use peer educators, since people seem to sort of feel like they got better information from their peers, whether they did or not. And I think for me, as someone who's really interested in sexual assault prevention, I think the fact that we found that a general knowledge test was associated with, a general sexual knowledge test was associated with more verbal consent communication is a particularly important finding. So what it suggests is that comprehensive sex education, even if it doesn't address consent explicitly, might have promise in promoting better consent attitudes and behaviors. And I think in part this is important because we don't have many sexual assault prevention programs that are effective in changing actual sexual assault perpetration behaviors. And I think one of the reasons this is likely true is that if we do sexual assault prevention and we, tell people don't rape people, here's all the ways that you should go about not raping people, it tends to promote defensiveness. People think, first of all, you're calling me a rapist, and I'm not a rapist, and none of this applies to me. And so it's not very effective in changing behaviors. But if we can change attitudes and behaviors that contribute to sexual assault just by giving people good general sexual information about communication and sexual response and those types of things, then we may be able to reduce sexual assault without promoting defensiveness. So in terms of future directions, we looked at these 10 sexual health themes. In our sample, people's ratings of what they learned about these 10 themes was pretty consistent, but that's partly because they said, we didn't get information about any of this. If we had a sample that had sort of more diversity in terms of the amount of sex education they'd had, it would be really interesting to look at how these different themes are associated with consent. So you could imagine that, for example, sexual boundaries and communication might be more important in terms of consent than sexual anatomy, for example. We also have these remaining questions like, perceived sex education was associated with attitudes and intentions. We thought that would be true, but we thought that would be true because better sex education would lead to more knowledge, which would then help attitudes and intentions. Since it wasn't related to knowledge, we don't know why perceived sex education was associated with consent attitudes and intentions. It must be tapping into something, but it's not knowledge that it's tapping into. So we think future research might benefit from kind of further teasing apart these relationships among people's perceptions of what they've learned, what they actually know, and various different sexual health outcomes.
All right. Thank you again to Bill for having us on this lecture series, and this is our contact information. I know I see the time, but
sorry, I kind of.
It's okay.
No, we do have a little buffer. If people are able to stick around, we could take one or two questions. I want to make sure, Kaylee, you said that you had the PowerPoint slide
Yes.
linked. If you want to drop that into the chat,
I will.
and then people. Thank you very much for sharing that and making it available on your Google Drive. So, we have just a couple of minutes because our speakers are going to be speaking again at in about a half an hour. So does anybody want to come off mute, put something in the chat, question that you have? I'll start with a couple of things in the chat. So do you folks want to read from the chat or you want me to read it to you?
Yeah, we can read it. Let's see. I'm wondering how someone identifies if their consent was violated if they only know assault to equal rape based on their education. Um, yeah, right. So if they lack, I think if I understand this correctly, like if they lack any education about what is consent and what does consent look like, how do you even know if your consent has been violated?
Mhm.
I think it's a great question, and I mean, we do know that many people who experience sexual assault don't recognize it as sexual assault and don't think about it in that way. And I think it's very likely that that's in part related to
Yeah.
lack of education.
Yeah, and the fact that like even if it goes unacknowledged, there still can be long-ranging consequences. Yep, exactly.
Yeah.
Actually, we asked a couple of qualitative questions in our study as well, and some people were saying, like, we asked about like where did you learn and like what's the most influential thing that you learned about with consent, and people were saying like it was actually when I had a sexual assault experience, which is really sad.
So regarding, so this is Abigail, regarding perceived consent being associated with consent attitudes, but not greater knowledge. Perhaps it is just due to a more general openness about sex. Yeah, good point. As an educator, I find that for young people, just knowing that it's okay to talk about sex and learn about it helps a ton. Yeah, so that's a good point. So maybe the reason perceived sex education is still associated with some of our positive outcomes, even though it's not associated with knowledge, is that maybe they didn't actually learn anything, but they felt like it was talked about around them, which creates an openness. Yeah, I like that.
That's a good point.
Are there, let's see, do you happen to know which of the 3 sexual assault programs are proven to reduce sexual assault prevalence?
Not off the top of my head, but in the slides that I sent you, I have all the references. And so DICU 2014 is within that.
Yeah, it's a great question. I think, as I recall, so there's more that are shown to reduce prevalence, but there's 3 that are specifically aimed at reducing perpetration. So there's some programs that reduce people's risk of being victims, but these are aimed at perpetration. As I recall, at least 2 of them, I think, are sort of middle school programs that are kind of broader than just sexual assault. They also include sort of interpersonal violence type training.
I'm going to jump in and do a little of the reading to take that responsibility off of you, if I may. So Michaela is asking, are there resources for identifying nonverbal consent?
Yeah. So yeah, how do you know that something's nonverbal consent?
Mm-hmm.
Yeah. I don't know if Kaylee has thoughts. I mean, I think this is why we chose to focus on verbal. Because
Yeah.
nonverbal is so hard, I think.
Yep.
I know that many, many years ago, the Young Adult Institute, which I think is branded now as YAI, developed an assessment tool for measuring nonverbal consent in people with a verbal as well as nonverbal consent, specifically in people with intellectual disabilities. I don't know if that's available for sale or if it's simply, at the time that I was familiar with it, it was internal, but I don't know if that's. But if you want to look that up, that's YAI, and I think they're YAI.org.
Yeah, thanks. That's interesting. I think it's such an interesting question because I think probably there are times when people can communicate non-verbally and probably both people really know what's going on, but it almost feels like you have to be there. It's like you know it when you see it, which is a scary idea when it comes to consent, right? Because what if you think you know it and you don't? So it's complicated because I do think people communicate very clearly non-verbally. But if you were going to sort of measure what's good nonverbal communication around consent, it's hard to kind of define.
Yeah. And then it's always, oh, sorry. Yeah, go ahead.
No, go ahead, Kaylee.
I was just going to say, it always depends with the context as well. And so like if a long-term relationship versus like a one-night stand and how maybe just someone in a long-term relationship knows the cues that your partner uses when that's consensual. And so thinking about all of those factors as well.
let's do these 2 more questions in the chat, and then we'll wrap up if that's okay. So no more questions. Don't post anything unless you have something really, really like you have to have an answer to. So Deborah is asking about texting consent, bringing us into the new generation, and also asking about your thoughts about the timing of consent.
You want to go first, Kaylee?
I mean, the texting of consent is huge. I think I remember reading a dissertation about that recently. So I think there has been some stuff done on it. And, you know, like I conceptualize consent as part of a process. And so, you know, you can definitely, you know, have some like dirty talk over Tinder or something that's like all consensual. And then that can be part of the process. And then you meet up, and then it can continue to be part of the process, but at the same time, like understanding that it can be removed at any time as well. So that makes it complex.
Yeah, I 100% agree. And I think it's that timing issue. Like there has to be consent at the time of the act. And so I think, you know, sometimes I've heard people sort of use that as like a defense, like, oh, but you know, they texted me. And so, and you know, they said they were coming over, they wanted to have a booty call, whatever it was. And so they consented, and look, I have this proof, but of course that doesn't mean that they can't change their mind. And so it does have to be, that may be part of consent, but it has to also be immediate, the consent.
And I think Krista Jakowski and colleagues did a study recently looking at like the situational context of consent in and out of the bedroom. And they found some interesting things about like men and women differences about if consent happened at a certain point earlier, that it was like assumed later or something. I could be messing up the conclusions, but that was interesting.
I was doing a webinar earlier today where on teaching safer sex, where I was talking about one of the classic sex education activities, the condom lineup, where you have different card for all of the steps of condom use. And one of the participants talked about how when they teach that lesson plan, they mix in 3 or 4 cards that say nothing more than consent, as a reminder that, you know, you can have consent, you need consent at the beginning, you need consent in the middle, you need consent, you know, you need to constantly check in with each other. I thought that was an interesting take on that activity.
That is interesting.
All right, we'll do one more, and then we really do need to wrap up. So in my workshops, I have people work through the ways in which they communicate consent and non-consent non-verbally in their personal ways, so that they can practice sharing that information with their partners. Oh, so more of an observation. I don't know if there's a question there, but feel free to comment.
I mean, I think that's really interesting. I know that there was some, like, I also did some sexual education outreach at my school for a while. And we did some like workshops with like just talking about like the nuances of consent and it being part of a process and how people communicate it verbally and non-verbally. But of course that's unique to each person's situation.
Okay, so we are going to wrap up in a moment. Thank you for staying a little bit longer. Thank you so much to our speakers. I have a link that I was planning on giving you that I can't find now, so I guess I won't give it to you, sorry. But next week we have Debbie Rothman is going to be talking about communication with parent-child communication about sex. What I'm looking for, Debbie, I know you're on the meeting right now. I can't find the title of your session. Do you mind coming off mute and saying the title of your session? We can't hear you, Debbie. Oh, thank you. Okay, well, we can't hear Debbie. Sorry about that, but I know it's going to be fantastic, and that'll be at 6 p.m. Eastern time next week. And let's see if I have a link. I'll see if I can get that up real quick. I found it. All right, drop it in the chat box now. There we go. Okay. Thanks for everybody. Thanks again to our speakers. Thanks for coming back in 20 minutes. And thanks everybody for spending the evening with us. And take care and be safe and healthy. Take care.
Thank you all.
Thank you. Appreciate it. I'm assuming we should